All right, everybody. Let me. I can't even see if this thing is on. The sun is so freaking bright. Okay, we're going. We are rolling. All right, hey everybody. So SITREP 5. It's the 20 whatever it is of September, 2019, 24th. Yeah, 24th, Tuesday. So I was at the hospital Friday, again yesterday, and today. So the big happenings are. Let me see. I met my radiologist. And she is a piece of work. She's very, very, very cool. Big discussion. I talked to her about the teeth, the whole dental thing. Holy crap. So let me start off with that. So over the weekend, I came to the conclusion that I did a lot of research, and I found some pretty interesting studies, and some of them suggested that, and they were pretty recent ones, that the instance of developing osteoradionecrosis of the mandible, which is the lower jawbone, is only like 4%, based on the kind of radiation I thought I was going to get, which is called IMRT, which is pretty new. So when I decided, you know what, I'm going to try and keep my teeth. That was my decision going in, or at least that was going to be my stance based on my research. So I meet the radiologist, we're talking about it, and she's like, I've never had anybody develop ORN, right? Osteonecrosis. And I'm like, yeah, but is that because you pull everybody's teeth? Like, there's absolutely no chance. Like, nobody's ever asked you to keep their teeth. She's like, come to think of it, no. I just go basically what the dentist recommends. I said, well, she's recommended that they take my teeth, and I don't want to do that. And she's like, kind of taken aback. She's like, holy crap, are you serious right now? Like, you're not going to make this easy, are you? So she's like, let me talk to the dentist, and we'll see what comes of that. Okay. So one thing, at one point I met her assistant, and I was like, hey, look, you guys are basically the mechanics, and this is my car, so I decide what happens to my body. And I think it was the pre-discussion about the dental thing, right? So during my talk with my radiation doc, she's like, oh yeah, by the way, she's like, you watch football? I'm like, meh, sort of, a little bit maybe. She's like, well, okay, if you can imagine a football team, she's like, you're a player, and all these guys at work here are players, and I'm the coach. And so, if you're going to be on the team, I need you to be 100%, and I need you to come in here and not be trying to call in and call off and say, oh, gee, I hurt too much today, I can't do my chemo. It's 5 days a week, dude. That's what we're doing. That's what you're getting. I can't have slackers on the team, right? She goes, also, I can't have any macho guys on the team. If you're hurt, you need to let me know, because we can stop treatment. I don't want to do that, but if you're hurt so bad, because it's going to burn you, right? If you're hurt so bad and we have to stop, Like, I'm like, okay. I said, are you done? Yeah, okay. I was like, pretty much, not to be rude, doc, but you might be the coach, but this is my stadium, okay? I own all this. So she kind of turned away from me. I kind of felt bad. I didn't want to put it to her like that, but I had to let her know, and the other players on my team know, no, yeah, you're the doc, and I respect that, but at the end of the day, this guy right here, I make the decisions. It's me, period. So anyway, left there. She proposed that they're going to try and get my, what do they call it? Simulation done. Simulation is they make this mask, and I'll talk a little bit more later, but they couldn't do it. I had to come back a little later today to do that. This is all going on today. So I go off, get some blood work done, go eat lunch. I come back to do sim, and they're ready. So it's basically this mesh, and the mask looks like this. Hopefully I can insert it this time, not like the video that I tried to insert last time, and it was at the end. But yeah, so that mask, basically you lay on the table that they slide you into the radiation machine on, and you have things under your knees. There's a board at the bottom of your feet to make sure you're at the same distance away every time. and they put this thing behind your neck, and then they take that and this mask and they put it over your head. Now it's form fit, and they buckle you down to the table so you can't move at all, right? So when I did it today, I was having problems. I noticed my tonsil right now is grown, and it's pushing into, it's almost at the halfway point. So it's actually encroaching behind the thing that hangs down in the back of your throat. It's behind that, but it's moving over, and it's almost halfway across my opening now. Freaked out, right? But anyway, so where was I going with that? Oh, so they lay me down, they get me all situated, and I'm like, hey, my airway, depending on where my neck is, up and down like this, when I turn to the left, I can't breathe out of my nose anymore. Like, it shuts off. And she's like, okay, I'm gonna make you a lollipop. So with a lollipop, she makes this goopy stuff, puts it in my mouth. She's like, I want you to get your tongue under this and push up. So she's got this handle, puts it in my mouth like one of those, don't get weird, like a gag, right? But it's like that, but it's got a stem sticking out like a lollipop, and it's molten. So she puts it in my mouth. It's not boiling hot, but it's warm. And then I push my tongue up, and now it's like filling up my whole mouth, all the way up top, all the way up to the roof of my mouth, out to my teeth. My teeth are biting in it in the front. My whole mouth is filled with this crap. A little airway behind my tongue, and then I can kind of breathe like that, right? So I'm like, okay, and this is gonna work. So they lay me down on the thing, and I have the lollipop in once it dried, and they're like, okay, ready? This is gonna be hot, but it's not gonna hurt you. And take this mesh, and they put it over my head and my chest, like about a little above my nipples, and they start pushing down. It's molding to my head, and at some point somebody must have pushed down right here, right on my damn nub of my Adam's apple, right? So I didn't think anything of it. You know, they're doing what they're doing, the professionals, right? So once that's done, they do some writing and stuff, and they clamp me to the table, and they start running me into the CT scan. The CT is going to actually get a three-dimensional image of my tumor and the lymph node. So they know exactly where to hit it with radiation, and I'll talk about that in a second. So they send me in the machine. I got earth in my mouth, you know, and the mask and everything. And at like my fifth or sixth breath, all of a sudden, I'm like, I can't breathe. I can't breathe out with my nose anymore. I can breathe in, but I can't breathe out. So now I'm like, you know, I can breathe in and out of my mouth, but it's only on the edges, and I feel my heart like, holy crap, this is it. You know, I'm gonna die in this damn machine, right? Because it's got like 6 or 8 like clamps to the table. It's not like you just push a button and psh, right? It comes off. No, this thing is like clamped down, right? Plus I got the thing in my mouth. So I didn't panic. I held my cool, and I was thinking, well, and I can see like 2 speakers. I don't know if they're like 2-way speakers or they're just like one way for music in kind of thing to me. But I'm like, you know, it's got to have some kind of safety mechanism. And I got to tell you, one of the women that worked there was kind of like dopey, like seriously, and she was the head one. So I'm like, holy crap, I'm gonna on all the crap I've been through in my life, I'm gonna die on this damn table because of this chick, right? But I sucked it up. I made it through, but you know, it was like I had the time when to swallow my spit, you know, and breathe in, and the thing was like, you know, like literally like right above your nose, this damn whatever. So yeah, it was a test. It was a test today. So, and I got a tattoo. Once that was done, they took it out. They did some markings and stuff. They put a tattoo on my chest. So now when they clamp me to the table, they can use that as a reference, and they know everything is lined up perfectly. That's important because I'm actually getting like one of the newest radiation machines and techniques. So every time I go in, they use the CT scan and my tattoo and my mask, and they align everything. So now the radiation beam goes around and it zaps it from all different directions, right? So it might be going right through my eye here and zapping it, but it's only like a small part of my eye right in that little spot. The next time around, I might move over like an inch and shoot it in the exact same spot here, but not through the same spot in my eye. Does that make sense to you? So really, it's not like sitting there going burn, 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 and like blasting everything in exactly the same proportion. It's actually moving around and shooting it from different directions all the time, right? And then every time I go in, and by the way, it's 5 days a week. Every time I go in, I take a CT because the shape and the size of the not every time, but I think after the second week ish, the tumor starts to change in size and shape. So they do another CT scan. That's the data they feed into the computer, and now it blasts it maps out different blast points, if that makes sense. So I think they call it RMAT. I think R-MAT, I think is the abbreviation for it. No idea what it stands for, but anyway, pretty cool. Let me see. So that's dental, huge thing. Oh, one of the last things I got to tell you, I had an option to either get stuck every time I go in. I'd have to go in. I'd have to go to the lab next door, get blood drawn. Then I have to get an IV put in for fluids, and then through that they also put in the chemo, right? So I could do that every single time I go for chemo, or I can get what they call a PICC line. That's the one underneath your skin. They go in, they put it in a major vein, and it's up under your skin. They stitch it up, and that way when you go in, they can draw blood out of this thing. They can put your chemo right in there. They can do everything right out of that thing, that port. So I opted to get that because I'm like, you know what? Chemo does a terrible thing to your little veins in your arms and stuff. This one's just, they sedate you up to put it in, good to go. And I also opted to get a feed tube up front because I think what some places do is they wait until you're like losing weight and your throat's raw and you just can't get enough nutrition in you. And then they decide to put in a line. And at that point, you're just miserable already. You're weak. So I decided, and they offered to put in the feed tube up front. So I might not even need it. I don't know. But at the end of the day, there's several different ways I can feed myself. They showed me how to do it with a little doll. I actually put water in there and it went into the doll, and it's pretty simple. I mean, it's not. Like I said, they kind of knock you out. They go in through your nose and out your stomach, and so it'll be sticking out of my stomach, and you just tape it to your side, and when you need it, you just untape it and do your thing and close it off, and yeah, so I elected to do that. So hopefully, hope to God I'm done this week. It's been crazy. I think Thursday I have to go. What do I have to do Thursday? I'm not sure. So yeah, I think I'm done with this week. Oh, so the dentist. I'm not done with the dentist, so sorry. So I talked to my radiologist, and she's like not happy, but she's like, all right, I'll talk to the dentist. So I went and did the whole thing, and I get sent back up to the dentist, and she's like, you know, the radiologist said she looked in your tongue and she's seen a chipped filling she's concerned about on this side, which is not the radiated side, it's the other side. And she said that she might consider, not having all your teeth pulled. So, and what the radiologist told me was maybe I could get just 2 out and keep the back tooth, and that way I get a bridge, right? So I'm back at the dentist, and the dentist like examines me again, and she's like, I don't see this chip. And she goes, honestly, your teeth are really good. She goes, you know what? Since we talked like just recently, remember I talked to the lead dentist. Well, I talked to one of our other chief dentists, and he was like, no, do not take that guy's teeth out. Don't do it. She's like, oh, great, thanks a lot. Like, I depend on you guys for, advice, and now you gave me 1 yay and 1 nay. So now what do I do? She goes, what I'm going to say is, if you want to keep your teeth, I'll let you keep them. You don't have to take anything out. I said, but you need to promise me this, and that, and I'm recommending that you get VA dental health for the rest of your life. I'm not supposed to have that. The only way you get dental through the VA is if you're 100%. But because I'm a cancer patient, and now I'm kind of high risk dental because they're gonna let me keep my teeth. She's like, I can at least get you a checkup and a cleaning every 6 months, and that way, I and us can keep an eye to make sure you're doing your stuff right. Because part of the problem is the blood vessels that go in your mandible, those get affected, and once they constrict, now you're getting less blood flow to your gums. It's enough to keep normal is okay, but Also, your saliva glands a lot of times get damaged to the point where they never come back. You don't have any more saliva. So the worst thing in your mouth for your teeth is having no saliva, because then you have nothing to flush away the bacteria, right? The radiation eats away your teeth, no saliva, less blood flow. So if you have any kind of trauma, you're screwed. Like and necrosis in your bone could happen too. So if you end up having any kind of trauma to your gum, if you have, let's say you need a tooth pulled out, they can't pull it out. The best they can do for me now is grind it down to the gum level. That's it. And that's the best I can get. So, and usually it affects these back 3 teeth on the bottom. So anyway, so she said, yeah, she'll stick with it. So I went back downstairs and I talked to the radiologist, and she was looking at me like, what did you do? And I'm like, what? She's like, what happened with the dentist? I said, well, I'm keeping my teeth. She's like, what? I said, yep, I'm keeping them all. She's like, you know what? You're going to mess up my perfect record. I said, no, I'm not. I said, I'm going to take care of my teeth. Don't worry about your record. I said, maybe your record is 100% because you pull everybody's damn teeth out. I said, no. So we'll see how it goes. I'm hoping for the best and planning for the worst. But I want my teeth. I'm a meat eater. I want to eat the meats. So don't get weird, Billy. I know what you're thinking right there. Don't be like that, dude. But yeah, so hey, good news. I'm gonna keep my teeth. Hopefully it's good news. Hopefully it's good news and I didn't make a bad decision. But I want to keep this as much as God made it, and yeah. So that's where we're going. So it should be good for a while. I think the next thing I'm gonna call, and I'm gonna get the PICC tube and the feed tube, pick and peg. I don't know what they call the damn things. The one up here for putting in medicine, and the one down there for putting in food. I think that's the next major event before, starting treatment. Oh, there's one last thing. Apparently, my body has P16, which is a tumor. What is it? Tumor suppression protein. And if your body has a positive P16, it's so weird. Like it automatically. Remember I was saying stage 3? Well, like I don't kind of get it. I'm only at stage 1. Like there's a totally separate chart for calculating what stage you are if you're P16. Who knew? So yeah. So despite the size and all that, my body produces this protein. It's like magic, but it's good magic. Dig it. So yeah, stage 1, stage 3, Mock's next to me. I'm ready to get this thing kicked off. I know I'm going to regret saying that because it's going to hurt a lot, but we got to get her done. I mean, I'm not getting any better sitting around. I started paperwork for FMLA, Family, what is that? Medical Leave Act, and also short-term and long-term disability. I mean, I don't know where I'm going to end up with nausea and all that. Apparently, nausea is a huge part of this. So I can't imagine sitting in my cubicle at work, or traveling on a plane, with work and barfing and stuff. So I'm like, you know what? I'm throwing in the towel. I'm going to start focusing on me. I've been focusing on my job for most of my life, and now I'm gonna downshift a little bit. Throw in the towel and take some time to get myself right. So I got to beat this thing. So that's where we're at, guys. I don't know when I'll do a video next because, man, I just dropped a lot on you, and I don't think I told you the next big things that are going to happen, so I don't even know if I'll do a video then. Like, yeah, I got them. I mean, what do you say about that? So, all right. Hey, take care. Talk to you soon, guys. Later.